Preconception counseling is highly recommended for women 35 years and older who are planning on becoming pregnant. Dr. Michael Haydon of Hoag Memorial Hospital Presbyterian in Newport Beach tells us how the counseling can improve outcomes.
It's important for patients to understand certainly there are increased risks of having a baby after 35, but the majority of women in this age group are going to go on to have very normal, successful pregnancies. But certainly the increased risks would be genetic abnormalities such as Down syndrome, miscarriages, and most women come to us looking because they may have some underlying infertility. So those are the main concerns that people have when they come to us in consultation.
Dr. Haydon told us about the benefits of preconception counseling.
The benefits are that you can identify medical problems earlier. Older women tend to have more high blood pressure, diabetes, thyroid disorder, and I can identify these things early and hopefully maximize their medical condition, and then choose medications that maybe would be safer in pregnancy that they could use for each trimester as well as during breastfeeding. So we have patients that tend to come into us for preconception counseling so we can discuss the risks they may have in their pregnancy, and then see them throughout their pregnancy both for genetic screening, ultrasounds, and then for delivery planning. And so when we see these patients in that long-term way, we can identify problems earlier and hopefully intervene and improve outcomes.
Dr. Haydon explains the laborious model.
Another benefit to delivering at Hoag Hospital is that we do employ a laborious model. What that entails is we have a physician in the community who has opted to either discontinue their practice or limit it and solely work at the hospital in 12 or 24-hour shifts in order to be available for emergencies. When women go beyond the age of 35, they become considered high risk. A big reason for that is the increased risk of genetic abnormalities encountered in these women. The reason is specifically the age of the eggs. As women get older, the aging process affects all the organ systems, including the eggs. And normally, mom has an egg that has one copy of chromosome 21, and that combines with the father's chromosome 21 in his sperm, and you end up with two. In older women who maybe have older eggs, there's a possibility of two chromosomes being in the egg and one chromosome coming from the father, giving a total of 3 chromosome 21. And when that happens, we call that trisomy 21, or what we know as Down syndrome. That's more likely in older women. It results in fetuses that have all the characteristic findings of Down syndrome, including the facies, heart defects, mental retardation. Now, there's no way to specifically decrease this risk, but we can do very early and very definitive testing to help identify it as soon as possible. I think what you see in the older moms is certainly they've already accomplished a lot in their careers, but they really have decided that this is the point in their life that they're going to have children, and so like you say, they're much more prepared. They're much more likely to seek preconception counseling, take the appropriate folic acid and prenatal vitamins, and then to really manage their pregnancy well with regular visits, good health care, and including a great diet. So the older moms tend to be just a little bit more prepared when the pregnancy comes. As we all are aware, there are a significant amount of pregnancy in this country that are unexpected, and these moms tend to have planned for these and are prepared.
Asthma, sleep tips, and how dark chocolate can affect your blood pressure. All this and more on the American Health Journal's Health News. Read some interesting health stories you won't see every day. Just go to thedoctorshow.com